Right, we start with questions to the Secretary of State for Health and Social Care. Father of the House, Sir Edward Leigh.
Number one, sir.
Minister.
Mr Speaker, Lord Darcy's report concluded that the health service is in a critical condition across the country and including in the East Midlands, where healthy life expectancy has declined in the last decade, with waiting lists in the region standing at slightly below the national average for 18-week waits at 57% compared to the national average of 58%.
With two-thirds of people having to wait more than 4 hours at Lincoln Hospital A&E, and with horror stories from my constituents of people waiting up to 24 hours, does the Minister understand that if we are to save the NHS and give people the timely appointments they need, then we must unleash the full power of the private sector?
I thank the honourable gentleman for helping underline the shocking inheritance that we have from the last Labour government. He's absolutely right. We are committed to cutting waiting times and serving his constituents like mine by delivering the long-term reform the NHS desperately needs. But the government is committing to the funding model. We're not going to change. I know he tries it every time, but we are committed to the funding model as it exists.
Mark Weston.
Thank you, Mr Speaker. As part of improving health outcomes in the East Midlands, but also across the country, a really important part of that is the use of diagnostics. And diagnostics such as the Rosalind Franklin Laboratory that was set up in my constituency, which was closed down just a few months ago at the cost of £0.6 billion. Would my right honourable friend agree with me that one of the most important things we could do is restore good quality diagnostics to our NHS?
Minister.
He is absolutely right. We are committed to improving diagnostics as part of our reform of the health sector. The waiting lists, when they are analysed, of 20% of those people will end up with a hospital admission, most of them on a day case. The focus must be on the early prevention, on diagnostics and consultant review at an early stage in order to improve those waiting times.
Mike Tapp. Minister.
The recent independent report from Lord Darcy makes absolutely clear that urgent and emergency care services are also struggling, with the latest data published last week showing that 1 in 10 patients are spending over 12 hours in A&E. We are committed to returning to service standards that patients should rightly expect through our ambitious 10-year plan to reform the health service.
Mike Tapp.
Thank you, Mr Speaker. In September 2021, Deal Hospital lost the provision for blood testing. After a long campaign by residents, it was agreed for this to return. However, this has stalled under the tendering process. Will the Minister meet with me to discuss how we can move this forward?
Minister.
Well, I commend my honourable friend for championing this issue on behalf of his constituents, and I understand he has raised this with the CEO of his local trust. He will appreciate that commissioning decisions are a matter for the local ICB, in this case Kent and Medway ICB, but of course I'm very happy to meet with him to discuss it further.
Andrew George.
Thank you, Mr Speaker. I wish the Minister well in her efforts to address this issue, because it is indeed extremely serious, and very often outside Trelisk Hospital there are more than 20 ambulances queuing, and it has a very serious impact on the expectations for those patients. But would the Minister please look at the potential of urgent treatment centres, which can actually take some of the very important pressure away from the emergency departments, such as the urgent treatment centre at West Cornwall Hospital in Penzance, which really does need to be re-established on a 24/7 basis, and that will make a real impact, please.
I thank the honourable gentleman for his good wishes. It is indeed a huge task we have before us. We will be maintaining ambulance capacity throughout this winter. He makes a valuable point about the alternative models to hospital admissions and treatment in the community. It is a matter for the local ICB, as I know he knows that the model that they see fit, particularly in rural areas, is one that they need to look at to reduce that pressure on the frontline and A&E services.
Paula Barker.
Intermediate care for people facing homelessness recommended by NICE can reduce rough sleeping by around 70%. This is life-changing for people who have been sleeping rough and plays a significant role in relieving pressure on hospitals. A recent evaluation of intermediate care for people facing homelessness in one county in England found a 56% reduction in A&E visits and a 67% reduction in emergency admissions. What exists currently is a postcode lottery. How can we embed the NICE approach in every ICS across England.
Well, my honourable friend highlights an issue that is often overlooked with homelessness that has risen to shocking levels in the last 14 years. Under the last Labour government, addressing the issue of homelessness saw people moved off our streets, and that included decent care at the front end of the hospital system and support in the community. She's right, there are good examples across the country. We'd like to see them embedded as part of our overall look across government at reducing the scourge of homelessness in society and, again, supporting the front end of the health service.
Alison Bennett.
Thank you, Mr. Speaker. I recently met with representatives from the Royal College of Emergency Medicine. They told me that the inadequate state of social care results in the deterioration of people's physical health, leading to more presentations at emergency departments. Does the Minister agree with me that if social care was properly funded, then pressure on our hospitals would be reduced?
Minister.
I thank the Honourable Lady for her question. What we see at the front end of the system is a result of the deterioration throughout the entire system and the flow of patients both from the community and through discharge and indeed through social care. That's why our ambitious 10-year plan will look at the patient pathway across that entire pathway to make sure that care is provided in the community, closer to home, and prevention is a key part of that, as well as our look at social care.
Smyth.
Number 3, sir.
Minister.
Mr. Speaker, after 14 years of Tory neglect and incompetence, adult social care is on its knees. The number of people receiving long-term care decreased between 2015 and 2023, and a staggering 130,000 staff vacancies in the system. So last Thursday, recognising the central role of our amazing care workforce, we took a critical first step, introducing the groundbreaking legislation that will establish the first ever fair pay agreement for care professionals. Mr. Speaker, I think it's fair to say that this government's done more for our adult social care workers in 14 weeks than the last lot did in 14 years.
Thank you, Mr. Speaker. With unfunded schemes like the National Care Service, with the new negotiating body's aim of establishing a minimum floor of pay and what amounts to a clear and expensive top-down reorganisation of the care system, can the Minister explain how he will maintain and enhance the role of local authorities like Buckinghamshire Council in targeting and delivering care, and how he plans to maintain day-to-day spending alongside this grand plan for reform without raising taxes?
Minister.
Well, it beggars belief, Mr. Speaker, to hear the party opposite lecturing us on fiscal discipline when there's a £22 billion black hole in the in-year position. We are committed to consulting widely on the design of a fair pay agreement, and we will engage with all those who may be affected. We're keen to ensure that all voices are heard so we can ensure that the financial impacts on the adult social care market, local government and self-funders are considered. But in a week where we've seen £63 billion of investment attracted by this government, just days after the Employment Rights Bill, we are seeing a government that is pro-business, pro-worker and pro-growth.
Jenny Riddle-Carpenter.
Thank you, Mr. Speaker. Adult social care is under extreme pressure. 1 in 4 hospital beds are occupied by patients with dementia. Will the Minister commit to a dementia strategy delivered in this Parliament?
Minister.
I thank my honourable friend for that extremely important question. I recognise that dementia is a huge issue that affects the entire country and indeed many honourable members across this House. We are absolutely committed to the research that's fundamental, and also as part of our fair pay agreement, it's not just about pay, it's also about training and terms and conditions, and we are going to be ramping up dementia training for our adult social care workforce.
Shadow Minister Sir John Whittingdale.
Thank you, Mr. Speaker. The Labour manifesto spoke of the need for a consensus on social care, and the Secretary of State has said that he wants to reach out across the political divide, although the message doesn't seem quite to have reached the honourable gentleman yet. In July at Questions, the Minister said there would be announcements in the near future. Since then, nothing. We are ready to talk. When will the government be ready?
Minister.
I'm not sure if the honourable gentleman was listening to my previous argument. My previous answer. We've just set out a groundbreaking piece of legislation on settling the adult social care pay issue, which is more than the last lot did in 14 years. But we absolutely are committed to building cross-party consensus. We know that we need a process that will be sustainable, that will fix adult social care for the long term. That absolutely includes engagement and dialogue across this House. We want to build a consensus that works. We recognise that successive governments have failed to get a grip on this issue, but we recognise the vital importance that adult social care is going to play. It's going to be a vitally important part of our 10-year plan for the future of the NHS, and I, of course, look forward to engaging with all honourable members on this issue.
Leigh Anderson.
Number 4, please, sir.
Minister.
I thank the honourable member for raising awareness of this important issue. He has spoken powerfully about the experiences of patients in his constituency as well as his wife's personal battles with sepsis. The long-term complications of sepsis can have a devastating impact long after discharge from hospital. Through the National Institute for Health and Care Research, the department is funding research to improve outcomes for sepsis survivors.
Leigh Anderson.
Thank you, Mr. Speaker. Abby Ixon from Ashfield last year lost both her hands and her lower legs to sepsis, and the local hospital was very slow to diagnose her condition. But since then, she's been suffering from a shortness of breath, fatigue and a lack of sleep. This could be post-sepsis syndrome, yet nobody at the hospital has spoken to about this. So does the Minister agree with me that every single sepsis patient survivor should be advised of this condition?
Yeah.
Minister.
Mr. Speaker, I absolutely do, and I want to pay tribute to Abby, a beautiful woman who I was privileged to meet after the Westminster Hall debate last week. Whilst care after sepsis will vary hugely on a care-by-care basis, we need to make sure that the needs of each individual are met. It sounds like in this case they haven't been, and if he wants to meet with me to discuss this further, I'm more than happy to do so.
Jim Dixon.
Thank you, Mr. Speaker. With last month marking Sepsis Awareness Month, will the Minister join with me in paying tribute to the courage of John Snow and his family in my constituency of Dartford, who has just tragically experienced a quadruple amputation due to sepsis, and the amazing support he's received from the Dartford community who have rallied round to help fund support for his family? And will he use this as a spur to improve treatment for sepsis more generally across the country?
Minister.
Can I pay tribute to John Snow and indeed my honourable friends' constituents that have rallied around him at his time in need. This does, though, highlight the need to have better joined-up care to ensure that those people who have sepsis receive the best care possible, that those that have tragically to lose limbs as a consequence of sepsis are able to have that good quality aftercare, and to make sure that we continue to raise awareness of sepsis and the risks it poses.
Blackwood.
Thank you, Mr. Speaker. We think that about 48,000 people a year lose their lives to sepsis, but the truth is we don't know because data is inconsistent. Will the Minister look at establishing a national registry to track sepsis cases so that performance can be measured, can be published and can be improved?
Minister.
Well, I hope very much that with the new national standards and the framework that have been put in place in this regard, that the NHS will be able to do precisely what the honourable gentleman wants it to do.
Sonia Kumar.
Thank you, Mr. Speaker. Yesterday was Allied Health Professional Day, which includes 14 professionals, includes physios, speech and language therapists and radiographers. Does the Minister agree with me that all the hard work for those professionals are really important to help with patient care?
My honourable friend makes a really important point, and look, the wonderful staff that we have working across health and care are the ones that are really ensuring that our constituents receive within a very tightly constrained health service the best possible care that we can give them. The NHS is broken. We have to fix that broken health service, and having good quality staff at the heart of it is how we are going to achieve that aim.
Coulter.
Question 5, sir.
Secretary of State.
Thank you, Mr. Speaker. Waiting times are wholly inadequate in our country. That's because the previous Conservative government took a golden inheritance of the shortest waiting times and the highest patient satisfaction in history, and left behind the worst crisis in the NHS's history. And what's more, Mr. Speaker, they accept no responsibility and can't even bring it on themselves to say sorry.
I pay tribute, Mr. Speaker, to my own family GP, Dr. Islam, at East Hall Family Practice. He goes above and beyond for his patients. But I know that GPs are troubled by the amount of time patients have to wait to see them. And there is a disparity between GP numbers in some areas, Mr. Speaker, is utterly shocking. In Kingston-upon-Thames, for example, a GP would look after 1,800 patients, but in Kingston-upon-Hull, that number's more than double. So what's my honourable friend doing to sort out the Tory mess of 14 years?
Can I, firstly, Mr. Speaker, through him, say thank you to Dr. Islam and, in fact, GPs right across the country who, against the extraordinary challenges of the backdrop they're working in, have nonetheless managed to deliver more appointments now than there were when there were thousands more GPs previously. He's absolutely right to point out that we don't have enough GPs in this country. That is why, within weeks of taking office, this government found just shy of £100 million to put into the front line to employ 1,000 more GPs onto the front line seeing patients before the end of this financial year. That will make a real difference, and she should have the humility and grace to accept that.
Thank you, Mr. Speaker. Patient waiting times are reduced dramatically through the recruitment and retention of more GPs. So will the Secretary of State welcome the work of Anglia Ruskin Medical School in Essex for everything that they're doing, and perhaps even have a conversation with myself and neighbouring MPs about how that medical school can be expanded to do much more to support the recruitment and training of more GPs in Essex?
I'm sure the right honourable lady does want more Conservative MPs in Essex, let me say, actually, given she raised an entirely constructive point, which I strongly welcome, this government is committed, as we were in opposition, to doubling the number of medical school places. That means real opportunities for local medical schools like hers. And of course, as ever, I'd be delighted to meet the right honourable lady to talk about what more we can do with her local university.
Abdusam Mohammed.
Thank you. I welcome the news that we are recruiting more GPs. This is very welcomed. I spent the afternoon shadowing a local GP and saw just how stretched the services were. Will the Secretary of State give commitments that we are moving towards investment in primary care services, and we'll be moving from the National Health Service to a focus on neighbourhood health services?
I'm really grateful to my honourable friend for raising that question. In fact, I was delighted to spend time in opposition with a whole group of GPs from across Sheffield who are showing us what primary care reform could look like. We are committed both to increasing primary care as a proportion of the NHS's budget, which will be important, but also to building exactly the kind of neighbourhood health service she describes, with more care closer to people's homes, and general practice has a key role to play in that.
Chair of the Select Committee, Leila Moran.
What we measure is so often what we end up improving, and one of the great assets that we have now from the Lord Darcy report is its technical annex with 330 analyses. It's incredibly useful. It's a baseline. My question to the Secretary of State is, will he make sure it's updated yearly?
That's actually a really great constructive challenge, Mr. Speaker. I am absolutely committed to transparency and to keeping that data set updated in the way that she requests. And look, we're not going to get everything right, and sometimes we're not going to make progress as fast as we would like. But where that's the case, we're never going to duck that. We're never going to pretend things are better than they are, because the reason why we will succeed where the previous government has failed is we're willing to face up to the challenges in the NHS rather than pretend they don't exist.
Shadow Minister Dr Ben Spencer.
Thank you, Mr. Speaker. The Prime Minister has repeatedly stressed the importance of preventing people taking up smoking as one of his priorities to improve the nation's health, waiting lists and demand on the NHS, and we agree. They like to talk about their record of their first 100 days in office, and according to data from ASH, 280 children under the age of 16 take up smoking in England each day. That's 28,000 children in England in his first 100 days. So why hasn't he reintroduced our tobacco and vapes bill yet? How many children need to take up smoking before he makes this a priority?
Mr. Speaker, maybe the Shadow Minister might like to give us the figures for the entire 14 years they were in government. And by the way, just to set the record straight, not only were the measures set out in the smoking bill, measures that I proposed in an interview with The Times earlier last year, if it was such a priority, why did they leave the bill unfinished? Why had it only gone through its second reading? And why did we go to the general election with that bill not voted through? I'll tell him why. Because his party was divided on the issue, and the Prime Minister at the time was too weak to stand up to his own right-wingers who are now calling the shots in their party. The smoking bill will be back, it will be stronger, and unlike the previous government, we will deliver it.
Liberal Democrat spokesperson, Helen Morgan.
Thank you very much, Mr. Speaker. My constituent, Mel Lycett, has terminal cancer. After repeated visits to her GP, she was referred on a 2-week referral, an urgent pathway, in May. She wasn't diagnosed until the end of July, and she still hasn't started treatment. Every single target for her diagnosis and treatment was missed. That's not uncommon in Shropshire, and it isn't uncommon in the rest of the country. Can the Secretary of State reassure me what he's doing to deal with this terrible legacy left behind by the Conservative government, and how we're going to ensure that cancer patients are treated in a timely manner?
Thank you, Mr. Speaker. I'm afraid what the Liberal Democrats' health spokesperson, and I welcome her to a role incidentally, has just raised, is just one of countless stories of people whose lives might have been saved had the NHS been there for them where they need it. It is bad enough when people receive a late diagnosis that equates to a death sentence. It is worse still when people in that particular position are then not given the fighting chance of the urgent life-extending treatment they might receive. The inheritance we have received is truly shameful. I can assure her, as a cancer survivor myself, because the NHS was there for me when I needed it, that we will work tirelessly with a national cancer plan to make sure that we deliver the cancer waiting time standards that the last Labour government met, that are sorely needed today.
Joanna Baxter.
Number 6, Mr. Speaker.
Minister.
As Lord Darcy identified in his review of the NHS, primary care is broken, with 1,600 fewer fully qualified GPs now than in 2017. We recognise that men can face particular challenges accessing services. That's why we are committed to fixing the front door to the NHS, bringing back the family doctor and shifting the focus of care away from hospitals into the community. Health is devolved in Scotland, but I welcome opportunities to share learning across our two nations.
Joanna Baxter.
Thank you, Mr. Speaker. In my constituency of Paisley and Renfrewshire South, the rate of premature death in men is 47.9% higher than the UK average. And according to National Records Scotland, the number of people who have died by suicide in Renfrewshire as a whole has increased to the highest level in 10 years. Does my right honourable friend agree with me that this is a damning indictment on the SNP government's record on health? And will he today commit to holding a summit in November to raise men's health higher up the agenda?
Minister.
Mr. Speaker, those statistics are damning and they are shocking. Health inequalities in any part of our United Kingdom need to be tackled. And I have to say to my honourable friend, the SNP government have real questions to answer when it comes to those shocking statistics affecting men in her constituency and across Scotland. On the other issue, I take up the challenge with my honourable friend. I think a summit with Movember and herself and other interested members to talk about men's health issues is a cracking idea, and it's something that I will get straight onto when I get back to the department.
Seamus Logan.
Thank you, Mr. Speaker. I appreciate the Secretary of State is unlikely to comment on the forthcoming Chancellor's statement, but you have mentioned, and your colleagues in the front bench have mentioned, funding issues on a number of occasions already this morning. So it would be helpful if he will confirm that it is the policy of his government to take steps to increase the UK's health spending to the average of other countries in the northwest of Europe, which would lead to an increase, I believe, of around 17 billion in the National Health Service, and would help to address some of those issues that my colleague across the chamber referred to.
Can I just say, they really ought to be linked to the question that we're dealing with, which is primary access. Now, I'm sure that you meant, is the funding also to help primary access? So I'm sure the Minister can look on that.
This Labour government was elected to tackle health inequalities, to fix our NHS and to ensure that more people live longer, healthier lives. That will require a concerted government effort, which is why we have the Health Mission Board in place. My right honourable friend, the Secretary of State, Mr. Speaker, is making the case for investment and reform at every opportunity he has. But let's be clear, every single Labour government has left the country with a better NHS than they inherited it, and this Labour government will fix our NHS once more.
Sir Ian Duncan-Smith.
Question number 7, Mr. Speaker.
Thank you, Mr. Speaker. Of course, I need to declare an interest because Whipps Cross Hospital is a hospital that serves my constituents as well as his, and I am well aware on that basis that we desperately need the proposed redevelopment of Whipps Cross Hospital. That is why, in common with so many members right across the House, I am absolutely furious that the previous government had a new hospitals programme whose timetable was a work of fiction and where the money runs out in March. The assurance I can give the right honourable gentleman, his constituents, my constituents, and the constituents of every other honourable and right honourable member across the House whose constituents are waiting for news on the new hospitals programme, is that we will deliver that programme. We will deliver it on a timetable that is credible and a programme that is funded, giving our constituents the clarity that they deserve, the consistency they deserve, and also rebuilding faith in government amongst our construction industry and supply chain.
Sir Ian Duncan-Smith.
Mr. Speaker, I'm grateful for that answer, as he knows, the Secretary of State knows that we together have campaigned for that, whether Labour or Conservative governments. It makes no difference to me. The reality, though, I want to drag him to a very specific point about this hospital, which is that they were granted 1.2 million towards doing the business case, which they got in August. Now, that has run out, and it'll be a total of 5 million required to be ready as and when the decision is made. If not, then they will have lost the architects and the builders. Can I put to him that if he can possibly go back to the department and say they should receive that money so they could be ready with their full detailed business case, ready for the moment when a decision is made. Otherwise, it could cost over the next year 50 million extra to get them back. So I beg him, and I literally make no bones about it, I beg him to look at that carefully.
I'm grateful to the right honourable gentleman for his question. Let me just say to him that those practical considerations are very much part of the review. And let me just say to particularly those poor project managers across the country who's dealt with the stop-start of the previous government, we are not going to make that mistake. We are going to come forward with a credible plan that is also funded, not the work of fiction or the £22 billion black hole that the Shadow Secretary of State left in her wake.
Kelvin Bailey.
Thank you, Mr. Speaker. Whipps Cross Hospital is in my constituency, and it's my constituents that have had to endure 5 years of the previous government organising photo opportunity after photo opportunity, and not the contracts that are now in place for that hospital project to be up and running and ready to go. Does my right honourable friend agree with me that only a fully costed long-term approach from this Labour government can actually deliver the modern health care my constituents need?
My parliamentary neighbour is absolutely right, and he's been doing an outstanding job representing the people of Leighton and Wanstead since his arrival. Of course, what his constituents and my constituents, and in fact people right across the country, deserve is honesty, clarity and consistency. That is how we will turn the new hospital programme from a press release into reality, and how, in doing so, we will restore trust in politics, and for business, the construction industry, the supply chain, restore confidence in public sector procurement.
Peter Bedford.
Thank you, Mr. Speaker. Many Leicestershire residents are concerned at the government's review of the new hospitals programme. This will have seen 2 new hospitals, a midwifery-led unit and a multi-storey car park in the city. What representations has the Minister made to the Chancellor to retain this vital investment for the NHS in Leicestershire?
Mr. Speaker, the honourable gentleman says, what representations am I making to retain the funding? I mean, if only. The funding wasn't there. The Conservative Party went into the general election with a programme timetable that was a work of fiction and a claim to have a funded programme that was simply not true. What we arrived to find was a timetable that was a load of rubbish and a £22 billion hole in the public finances that they hid from the country because they didn't want to confront the hard truths. Well, this government's facing the facts and we're answering the challenges too.
Dr. Stellicus.
Thank you, Mr. Speaker. As probably the only MP in this current chamber who's actually recently used Whipps Cross, because I had both my children there, because it serves my community in Walthamstow, I know firsthand how desperately it needs redevelopment, how poor the facilities are that the amazing staff are having to use. But does my honourable friend agree that finally getting this project moving under a Labour government will also deliver thousands of much-needed homes in our local community? It is a win-win, and that is why it's such a travesty that for years Conservative ministers came and took photos, but there were never diggers and spades in the ground. Labour can change this. Does he agree?
My honourable friend is absolutely right, because, of course, it's not just about the necessary hospital project, it's also about the growth that will come through construction and getting these projects actually up and running, and, of course, the role that the NHS plays as an economic anchor institution in communities, the housing sites that will be unlocked, the local transport infrastructure that will necessarily come with some of these projects. We're mindful of all of that. The most important thing is that we come forward with a timetable that is credible and a programme that is funded, and that is exactly what we will do.
We look forward to landing jolly on that basis. Michelle Scrap.
Question number 8, Mr. Speaker.
Minister.
Lord Darcy's report concluded that the health service is in a critical condition across the country. District hospitals have a vital role to play in meeting the needs of their communities, and this government will support them to reduce waiting times, to improve urgent care and to play their part in building a neighbourhood health service.
Michelle Scroggan.
Thank you, Mr. Speaker. Critical care at Furness General Hospital in Barrow has been temporarily downgraded, meaning that those who were in most need of the highest level of care are now exposed to potentially life-threatening delays during a 50-mile transfer on difficult roads. Will the Secretary of State, will the Minister please look at this worrying decision by the University Hospital of Morecambe Bay Trust and do everything to make possible the reopening of this as soon as possible?
Minister.
My honourable friend is a doughty fighter for her constituents, and I am aware that the decision she mentions is an interim measure made by the Critical Care Network, Lancashire and South Cumbria Integrated Care Board and the NHS Trust. The decision will be kept under review and patients impacted will receive the appropriate support. The Government recognises that more must be done to improve the sustainability of the NHS both nationally and in rural and coastal areas.
Greg Stafford.
Thank you, Mr. Speaker. The services at the Chase Community Hospital in my constituency in Whitehill and Borden is having its services run down by the ICB. This is based on a promise that a brand new health hub will be built in place. which is much welcomed, and it's got the support of the DIO, which owns the land, it's got the support of East Hants District Council, and it has community support. But the ICB is suffering from inertia around this. What can he do to speak to the ICB to either build this new health hub or refurbish and renovate the Chase Hospital?
Minister.
I mean, look, I've every sympathy with the case that he's put forward, because this government wants to see a shift of health services from hospital to community, from analogue to digital, and from sickness to prevention. But these decisions are not taken in inertia. These decisions are taken because of the inheritance that the government has found from his party. 14 years of running down our health services, needless reorganisations that have destroyed and set back the progress that the last Labour government made on the NHS. This government will fix the NHS, including in his local area. But he does have to recognise that the root cause of many of the problems that are being faced by members across this chamber lie at the feet of the former Secretary of State and the last government.
Shadow Minister Dr Caroline Johnson.
Thank you, Mr Speaker. We've heard already this morning about the challenges facing Whipps Cross District General Hospital. But the Secretary of State's decision to pause capital projects across the country and put them under review has caused worry and uncertainty for staff in those hospitals nationwide. Can he say when this review will be completed, and so that we have certainty of when things will be going ahead?
Minister.
The review will be completed when all the information has been analysed. The Honourable Lady should not just be a little patient, she should be a little more apologetic for the fact that this government found a hospital rebuilding programme that wasn't worth the paper it was written on, because the ultimate paper we needed, the cash, wasn't there.
Picture.
Question number 9, Mr Speaker.
Minister.
I would like to pay tribute to my honourable friend for the excellent work he does for the people of Doncaster East and the Isle of Axholme. The scale of the problem that he points out is massive. One of the most shocking statistics I discovered since I took up this position is the most common reason for children aged 5 to 9 being admitted to hospital is for tooth decay. It is completely and utterly shocking, Mr Speaker. It is truly Dickensian. We cannot fix this overnight, therefore. We're committed to reforming the dental contract, working with the BDA to focus on prevention and retention of NHS dentists. We're also working at pace to ensure that patients can access 700,000 additional urgent dental appointments.
Leigh Pitcher.
Thank you, Mr Speaker. The horror stories I hear in my constituency are just awful. From the mum who couldn't find an NHS dentist after 5 years on the Isle of Axholme and carries out her own treatment to her son, to a gentleman whose teeth are crumbling due to illness, causing horrendous pain, who cannot get an appointment in Doncaster East. The government's pledge to provide more emergency appointments is great, but I know that it will take time to rebuild dentistry. So can the Minister reassure me that people in my constituency will be given the priority that they deserve?
I thank my honourable friend. He's right. South Yorkshire has the highest level of hospital tooth extractions in England, and I want to assure him that we will target interventions at areas of greatest need. For example, integrated care boards have started to advertise roles through our Golden Hello scheme that will drive recruitment of graduate dentists to areas of greatest need for 3 years. We have inherited a mess, and we are working at pace to clear it up.
Jim Shannon.
Mr Speaker, can I thank the Minister very much for that answer. Minister, you're right to underline the issue for children, but can I remind the Minister as well the issue for those who are over 65 or over 67 in the case of ladies, in particular when it comes to certain benefits such as a tenants allowance. Would the Minister agree to looking at the contract for those who are elderly and receipt of benefits, in particular a tenants allowance? Thank you.
Minister.
I thank the honourable member for his question. I mean, we're in a situation where a staggering 28% of the country have an unmet need for NHS dentistry. That's 13 million people. So there are so many issues that we need to resolve. We are looking at the contract with the BDA, and I'm more than happy to look into that particular issue that he's raised.
Shadow Minister Sagib Bate.
Thank you, Mr Speaker. Last month, the Welsh Secretary told Labour Party conference that this Labour government will, and I quote, take inspiration from Labour-run Wales on dentistry. This is the same health system that is completing less than 60% of the dentistry courses it was doing before the pandemic, a rate far lower than England. So does the Minister agree that the Secretary of State for Wales is right and that Wales is a blueprint for what a Labour government will do in England? Or will they drop the bluster, will they get serious, and will they commit to the dental reform set out in the Dental Recovery Plan, including a tie-in to NHS dentistry for graduate dentists?
Minister.
I just find it extraordinary, Mr Speaker, that yet again we see a total lack of humility and contrition from the benches opposite. The key difference that we're going to see in terms of the way our United Kingdom works is that we've now got some grown-ups in charge in Westminster who will be working with colleagues in Cardiff Bay to ensure that the rising tide lifts all boats and that we improve the state of NHS dentistry right across the United Kingdom.
Lukakis. Speaker.
Question number 10, Mr Speaker.
Minister.
Thank you, Mr Speaker. With permission, I will take questions 10 and 15 together. Our mental health service is on its knees thanks to 14 years of Tory neglect and mismanagement. A staggering 1 million people are waiting to access mental health services, vacancy rates around 10%, the highest across the NHS. This government is committed to fixing our broken NHS so people can be confident of accessing high-quality mental health support when needed. This includes recruiting 8,500 more mental health workers, introducing specialist mental health professionals in every school, rolling out Young Futures hubs in every community, and modernising the Mental Health Act.
Thank you, Mr Speaker. Patients tell me they cannot get access to community mental health nurses, putting huge pressure on GP practices and leading to people going to A&E in desperation. Can the Minister confirm whether the 8,500 extra mental health staff pledged in Labour's manifesto will include much-needed nurses in the community?
I pay tribute to my honourable friend who's doing excellent work for the people of North Durham. I'd also like to take this opportunity to thank our mental health nurses who do such vital and valuable work. The government is committed to shifting from hospital to community, and that includes, of course, in the mental health sector. So I can assure my honourable friend that we're working with NHS England on how best to deploy these 8,500 additional mental health workers.
Chris Ware.
Thank you, Mr Speaker. I'd like to pay my respects to the family of Jamie Pearson, the 27-year-old Blackpool man who sadly took his own life in a local hospital in August after waiting nearly 24 hours to see a mental health worker in A&E. Jamie was in a mental health crisis, but got himself to what should have been a place of safety. What steps is the Minister's Department taking to ensure no one is left to suffer in A&E because they can't access the mental treatment in the local community, and will he agree to meet with me to discuss this tragic issue so we can make sure it never ever happens again?
Minister.
Well, I thank my honourable friend for raising this deeply tragic issue. Words can't express the heartbreak that this will have caused to Jamie Pearson's friends and family. I hope it might be some small comfort to them to know that all acute hospitals should now have a 24/7 mental health liaison service in A&E, and we are looking at how best to take forward the government's suicide prevention strategy for England. We will do everything in our power to ensure that the tragic circumstances around Jamie's untimely death are addressed, lessons are learned, and of course I'd be happy to meet with my honourable friend to discuss this further.
Karin.
Thank you, Mr Speaker. Child and adolescent mental health services in South Cumbria do an outstanding job, and yet they are without a dedicated crisis team, unlike the rest of the Trust in Lancashire and South Cumbria. That is devastating for my constituents and dangerous for them too. Would the Minister use the power that he's got to intervene with both the ICB and Lancashire and South Cumbria Care to make sure that young people in our communities have access to a crisis team?
I thank the honourable member for that question and the passion with which he put it. We are committed to rolling out Young Futures hubs across the country, and of course, where there are areas of particular need, that is where we need to prioritise. I would be happy to meet with him to discuss that further.
Vera Wilson.
Review of children's mental health services in my local authority, London Borough of Richmond, found that staggeringly children with mild to moderate needs, Tier 2, were waiting on average 15 months until they received treatment, and those with more severe needs on average 9 months. The Minister doesn't need me to tell him that during that period, children's conditions get worse, they need greater treatment, and sadly too many are presenting at A&E self-harming and attempting to take their own lives. So can I ask the Minister, as well as committing to mental health professionals in every school, will he put some money into that acute provision so that children aren't ending up in A&E?
I thank the honourable member. We are absolutely committed to the 3 shifts from hospital to community, from sickness to prevention, from analogue to digital. I think the sickness to prevention aspect is very important in the question that she raised. Treatable mental health conditions like anxiety and depression should be identified early to prevent them from developing into something more serious and a crisis. So I absolutely share the sentiment of her question, and that is going to be at the heart of our 10-year strategy for the future of our health.
Clive Jones.
Question number 11, Mr. Speaker.
Minister.
With your permission, Mr. Speaker, I'd like to take questions 11, 14, 17 and 20 together. As identified in Lord Darcy's review, primary care is broken. Satisfaction with GP services has fallen from a peak of 80% in 2009 to just 35% last year. A truly damning indictment of 14 years of Tory failure. We will rebuild general practice. We've invested £82 million to recruit 1,000 new GPs. We've launched our red tape challenge. We're committed to improving continuity of care and ending the 8 a.m. scramble. Regarding primary care more broadly, we're committed to boosting the role of community pharmacies, enabling patients to be treated for certain conditions by their local pharmacist without having to see a GP.
Thank you, Mr. Speaker. The Arborfield Green community in my constituency of Wokingham has around 10,000 residents in new homes, and there's many more to come. There is no local primary care provision, and to see a GP, residents must travel to neighbouring villages, often inaccessible because of public transport. What steps will the Minister be taking to guarantee that there will be enough GPs in major new developments that come down the line?
I thank the honourable member. He's absolutely right. There are seriously under-doctored areas of the country. We know that with the finite resources we have to focus on areas of greatest need. And I'd be more than happy to meet with him to discuss how that might reflect best in his own constituency.
Katrina Murray.
Thank you, Mr. Speaker. Access to GP appointments is an issue that's consistently being raised with me in Cumbernauld. However, a number of constituents have informed me that, having made complaints, that they are being removed from the lists of the general practice that they have been patients at for many years. Can I ask the Minister to raise this matter with the Cabinet Secretary for Health and Social Care in the Scottish Government so we can get some resolution for my constituents?
I'd like to thank my honourable friend for that question. Patients have an absolute right to complain about NHS services. They should absolutely not be being removed from a practices list because of a complaint they've made. Health is, of course, a devolved matter, but I have asked officials in the department to engage with their Scottish Government counterparts on this matter to ensure that patients in her constituency are treated with the respect and the compassion that they deserve.
Catherine Atkins.
Thank you, Mr. Speaker. Residents in Mickleover have been queuing from 7 a.m. to get an appointment to see their GP, and Health Watch say that 7 in 10 people in Derby find it very difficult to book appointments. That is the legacy of the last government, and with the new homes being built in and around Mickleover, we need even more additional capacity. Does the Minister agree with me that GP capacity must be a priority?
Minister.
I thank my honourable friend. We're absolutely committed to the challenge of cutting red tape, reducing the administrative burden for staff to help patients get the care they need. A very important element of our plan is going to be to streamline access to registration, to move it online, and we're working at pace to make online registration available in all practices. Very happy to take away the particular issue that she has in her constituency and come back to my honourable friend on that issue.
Verinder Jess.
Thank you, Mr. Speaker. Lord Darcy's report on the NHS states that people are struggling to see their GP. Prevention is better than cure, and interventions protecting health tend to be far less costly than dealing with the consequences of illness, which can be both in terms of finances and the outcomes of illness. Early and quick access to primary care is therefore crucial. Whilst accepting that it is not always necessary to see a GP when perhaps an appointment with a nurse can be just as sufficient, can the Minister please confirm what steps are being taken to ensure that patients in my constituency of Wolverhampton West can have quick, easy and direct access to GP surgeries?
I thank my honourable friend, and I note that Wolverhampton West has seen a decrease of 28 full-time equivalent GPs since 2018, which is of course massively exacerbating the issues to which he refers. We will introduce a modern booking system to end the 8 a.m. scramble, and we're going to make it easier for patients to contact their GP. We're committed to increasing the use of the NHS app in particular to view patient records and order repeat prescriptions, all of which will take pressure off the booking system.
Patrick Spencer.
Thank you, Mr. Speaker. Last week, NHS Suffolk and North Essex announced plans to scrap the super surgery in North Essex. To say my constituents were incandescent would be an understatement. Many of them have waited since 2021 for a replacement to close surgeries in Bramford, Claydon and Great Blakenham. Many have to use Needham Market surgery, which is also waiting for plans to move to a larger premises and increased capacity. Will the Secretary of State meet with me to discuss how we can expedite these plans to expand primary care in North Ipswich and the surrounding villages?
Well, I thank the honourable gentleman for just setting out a list of all the failures of the last 14 years, and the mess that he's dealing with is thanks to the benches that he sits on. Look, I would strongly encourage the people in his constituency to whom he refers to get very actively involved in the 10-year plan that we're going to be launching. There's going to be a really important national engagement exercise that's going to be talking about shifting from hospital to community, from sickness to prevention, from analogue to digital, because we need systemic reform given the total and utter chaos that we inherited.
Thank you, Mr. Speaker. Mr. Speaker, I recently met with Martins Oak and Oldwood surgeries in my constituency, both of whom have ambitious plans to move to bigger premises so they can see more patients. They face challenges, numerous challenges, including a gap between the lease length that the ICB will support and the lease lengths that GP practices can get developers to sign up to. There are other challenges I'm sure he can help unpick. Would be willing to meet with me just to see if we can help them get the fruition, these ambitious plans they have for new surgeries.
Minister.
I thank the honourable gentleman. I know he has considerable expertise given his background. I'd be happy to discuss the issue with him, but what I would again remind him of is there may well be specific issues, but there is a generic problem, which is the total and utter failure in terms of investment, in terms of reform and in terms of strategic thinking about our system.
Topicals now with Chris MacDonald.
For one, Mr. Speaker.
Thank you, Mr. Speaker. Today I'm publishing the 4 findings of Dr Penny Dash's review into the Care Quality Commission. Her interim report made clear the CQC was not fit for purpose, fewer inspections were being carried out, urgent follow-ups being neglected, patient safety put at risk. And today she makes 7 recommendations for improvement. I've made sure the CQC has begun urgently putting them into practice. We're also publishing a review of their deeply flawed single assessment framework today, and Sir Julian Hartley will shortly begin as their new Chief Executive with my full support.
Mr. MacDonald.
Thank you, Mr. Speaker. My constituent Mark has been unable to find an NHS dentist for his 19-month-old child, even at the 7th time of trying. My right honourable friend well understands the crisis he's inherited. Will he meet with me to discuss the shortage of dentistry in Stockton North and across Teesside?
Mr. Speaker, I'm just so sorry to his constituents and so many others who are dealing with the consequences of the Conservatives' failure on dentistry, and I'd be delighted to meet with my honourable friends to discuss the challenges in his area.
Shadow Secretary of State Victoria Atkin.
Thank you, Mr. Speaker, and may I congratulate all nominees and winners in the NHS Parliamentary Awards yesterday. They were richly deserved, and I think it was a very good example of the House coming together to celebrate those who work so hard in our health service and social care services. In the last 5 weeks, I have asked the Right Honourable Gentleman 29 questions at this dispatch box, yet he's managed to answer only one. For the rest, he's tried to bluster his way out of his own policy decisions, as indeed we've seen this morning. So let's try again. Which is the first week that his promised 40,000 more appointments will be delivered?
I mean, after the performance I had to put up with when she was at this dispatch box, she's got some brass neck turning up at that dispatch box complaining that I'm not answering her questions. She will know that we are working at pace to stand up 40,000 more appointments every week as our first step, as promised in our manifesto, and we will deliver. And more than that, we will go into the next election with a record that she could only dream of.
Victoria Atkins.
So, after 14 years of opposition, 2.5 years of which he's been sitting on these benches, travelling around the world, funded by other governments to look at their healthcare systems, and over 100 days in this government, he doesn't even know the start date of his own flagship policy. He's no action man, Mr. Speaker. He's anchor man. But let's deal with Labour's cruel decision. After Labour's cruel decision to slash winter fuel payments, which will add pressure not only to patients but also to the NHS. The NHS's Deputy Operating Officer.
Please, I've got a lot of people to get in. They've got to be short from both front benches. Victoria.
After Labour's cruel decision to slash winter fuel payments, which will add pressure to the NHS's Deputy Operating Officer has warned that this winter our health service won't have the extra capacity or funding needed and which had been provided previously by the Conservatives. Why has the Secretary of State...
No! Please. I did give you a hint to come to an end, not to carry on fully. That is... No, it's not fair. It's unfair to both of the backbenches that I'm trying to represent. I want a short answer back.
Mr. Speaker, she questions the budget for this winter. It was a budget set by her government. So is this finally an admission of failure on the part of the Shadow Secretary of State? And I'll tell her something else we'll have this winter that we didn't have last winter or the winter before, and that's no...
Lila McAvoy!
Can the Secretary of State meet with me to discuss a cross-departmental pilot in my constituency of Darlington, bringing together the DWP, education and health to tackle some of the immediate pressures facing CAMS and mental health services in my area, the impact these are having on schooling, the local workforce and family outcomes?
Minister. I thank her for that question. By cutting mental health waiting lists and intervening earlier, we can get this country back to health and back to work. 2.9 million people economically inactive, a large proportion due to mental health issues. Many people can be helped back into work through talking therapies, and we're going to be putting a mental health professional in every school, rolling out 8,500 specialists, and I'd be happy to meet with my honourable friend to discuss further.
Person Helen Morgan.
Speaker, 4.4 million children in England haven't seen a dentist for at least a year. Meanwhile, in Shropshire, Telford and Wrekin ICB, £1 million of dental funding went unspent in 22-23. The system's clearly broken. When can we expect him to fix it?
Mr. Speaker, it is precisely because of the situation she describes, both the poor services and also, ironically, the underspend in the dentistry budget, that we'll be working not only to stand up the 700,000 urgent and emergency dentistry appointments we promised, but also to do the prevention work for children in our schools.
Speaker, many in my constituency are very, very grateful that Slough will soon be home to a £25 million community diagnostic centre, which will help to reduce waiting lists. But many are also concerned that the local trust may be contracting out services for MRI scans. Does the Secretary of State share my concerns that instead of just outsourcing, local trust should, wherever possible, try to increase expertise and capacity in-house?
We are committed to expanding community diagnostic capacity to build an NHS fit for future. We are clear, however, that independent sector providers have a role to play in supporting the NHS as trusted partners to recover elective services.
Stevenson.
Thank you, Mr. Speaker. I welcome all efforts to increase the number of GPs throughout England. Residents in new and growing towns like Wixham's in mid-Bedfordshire need a GP surgery, and my local councils have been told that they need to put up the capital to deliver one, causing concern over cash flow and borrowing costs. Will the Minister meet with me to discuss a new capital investment programme to ensure that residents in new towns like Wixham's don't have to wait for developer contributions to get the services they need?
As Lord Darcy outlined, capital development in the NHS is shocking. It's behind £11 billion worth of background. I'm very happy to meet with him about his particular problem.
Ruth Jones.
Thank you, Mr. Speaker. Alan Peterson is a senior pharmacist in my constituency, and he tells me pharmacies have seen high volatility in drug pricing and big increases in bills in recent years, and at the same time they're expected to do far more in direct consultation with the public. So given the UK's government's jurisdiction over the funding of dispensing services across England and Wales, can the Minister tell me when the government plans to review pharmacy funding?
I thank you for that question. Obviously, health is a devolved matter, and the funding for pharmacies in Wales is the responsibility of the Welsh Government. Nevertheless, I pay tribute to the Welsh Government for securing a deal with pharmacies in Wales in line with the DDRB pay recommendations. I know arrangements in England also affect pharmacies in Wales, and I'm working as a matter of urgency to conclude the consultation on community pharmacy contractual framework.
The Tobacco and Vapes Bill actually went through its committee stage at the last Parliament to correct the Secretary of State for Health. At that stage, a number of amendments were proposed across the chamber. The then Minister, Andrea Leadsom, agreed to take those amendments away and bring them back. When he brings back the bill, will he incorporate those amendments so we strengthen the bill?
Whatever stage it got to, Mr. Speaker, it wasn't completed, was it? We will bring back a tobacco and vapes bill which is stronger than the Conservative Party, and I look forward to seeing if they support it.
Rebecca Lumberley.
In the city of Salford and was temporarily closed in 2022 amid an acute midwifery staffing deficit across Greater Manchester. So would the Secretary be kind enough to meet with me to discuss what he can do to ensure that this unit opens safely as soon as possible?
Minister.
She's right to raise the crisis of midwifery services. We've already had debates in Westminster Hall about this. It's an issue that affects the entire country. It is a priority for this government, and I'm, of course, happy to meet with her to discuss her constituency issue.
Ollie Glover.
Thank you, Mr. Speaker. Lord Darcy's report highlighted the importance of local focus and alignment to coordinating local services and improving health, contributing to reduced hospital admissions. In Oxfordshire, the Integrated Care Board is proposing to remove Oxfordshire's dedicated place director. Will the Minister give his support to place-based roles to maintain local authority alignment as recommended in Lord Darcy's report?
Minister.
Mr. Speaker, I absolutely take the point the Honourable Gentleman's making about the importance of place-based leadership. That's why one of the things we'll be looking to do as part of the 10-year plan process is to clarify roles and responsibilities within different parts of the system to make sure we've got better strategic place-based leadership.
Thank you, Mr. Speaker. Mr. Speaker, the Royal Stoke Hospital is leading the way when it comes to treatment for stroke patients, but like so many illnesses, prevention is better than cure. So could the Secretary of State set out what this government is doing to minimise the number of people affected by these life-altering events?
I agree with my honourable friend. That's why we've set a goal for fewer lives being lost to cardiovascular disease. We're going to make it easier for people to have checks in the comfort of their own homes through things like the digital NHS health check and through the new workplace trials.
Jerome Mayu.
Labour's cut to the winter fuel payment will cause 262,000 coal pensioners to seek NHS treatment, according to the End Fuel Poverty Coalition. Does the government agree with those figures, and if not, what are their own estimates?
Minister.
Mr. Speaker, the decision on winter fuel allowance is not one that the government took lightly, but we inherited a £22 billion hole in the nation's finances. We continue to stand behind vulnerable households, increasing the state pension with the triple lock, delivering the Warms Homes discount, and to extend the household support fund to support the most vulnerable pensioners.
Prevention is the most important intervention to improve health outcomes, and yet since 2015 the public health grant has fallen in value by 25%, 30% in York. Could the Minister say what he's doing to restore the value of the public health grant?
Minister.
My honourable friend is incredibly knowledgeable in public health matters, both at a national and local level. Lord Darcy's investigation into the NHS set out the impact of past reductions to local government public health funding. We will confirm public health grant allocations for the next financial year as part of the forthcoming spending review, but the points she made have been made loudly and clearly.
Mr McVeigh.
Can the Secretary of State update the House on the status of Alan Milburn? Is he still attending meetings in the department? Is he still got access to confidential information? Is he now got an official role in the department? And does he still have interest with the private sector in the healthcare sector?
Mr Speaker, the Right Honourable Alan Milburn is alive, he's safe and we're treating him well.
Mary Kelly Foy. Mary Kelly Foy.
Thank you, Mr Speaker. October is Breast Cancer Awareness Month, and I stand here as someone today who was diagnosed, treated and cured of breast cancer this year by the amazing staff in the North East. But not enough women are taking up their breast screening appointments. So will the Secretary of State do more to raise awareness of and access to breast screening appointments? And can I urge all women to check themselves regularly?
I pay tribute to my honourable friend for the work she's done in this area and for also setting out eloquently her own personal experiences. Of course, this government will do more to raise awareness and to enable more women to access breast screening services.
Final question, Simon Hall.
Speaker, a significant impediment to improving adult social care is the split of budget and responsibility and policy between the Secretary of State's department and the Department for Housing and Local Government. Will he and colleagues work to remove that hurdle, to have better outcomes, more cost-effectively delivered, to improve the lives of all of our constituents?
Secretary of State.
Mr Speaker, he's right to raise that risk. I can assure him and the House that myself and the Deputy Prime Minister, herself a former care worker, are working in lockstep to align strategy, policy and delivery.
Right, that completes questions. We'll let the front bench change over.